Enuresis and incontinence, we discussed the pattern, kidney and deficiency. Clinical manifestations, incontinence of urine but in scanty amounts, dribbling after urination, dark urine, dry throat, dizziness, tinnitus, night sweating, insomnia. Tongue without coating. If there is empty heat, the body is red. Pulse, floating empty. Treatment principle, tonify the kidneys and nourish yin. Points, RAN 4, kidney 3, spleen 6, bladder 23, 28, lung 7, and kidney 6. Reinforcing method, no moxa. RAN 4, kidney 3, and spleen 6 nourish kidney yin. Bladder 23 and bladder 28 tonify kidney qi and strengthen the bladder function. Points in the back are used as, although there is a deficiency of yin, it is still necessary to tonify the yang within the yin to control fluids. Lung 7 and kidney 6 in combination regulate the renmai, or the directing vessel, and nourish the yin. Case history. A 65-year-old woman had been suffering from slight incontinence of urine for several years. 6 years previously, she had an operation to correct a prolapse of the bladder, but it did not help the incontinence problem. Her urinary problem was quite complex in that she suffered from a slight incontinence but also from frequent urination, frequent urinary infections with burning on urination, and difficulty in urination or dysuria. 5 years previously, she had an operation to stretch the urethra, but this did not help any of her symptoms. During the last 2 urinary infections, she also had blood in the urine. This patient also felt exhausted all the time and suffered from lower backache and dizziness. Her pulse was very weak and deep, and her tongue was red and slightly without coating. In terms of Chinese disease, Tianping, identification of the disease, this pertains to both blood urinary syndrome and incontinence of urine. In terms of patterns, there are various patterns. Firstly, the incontinence of urine is due to sinking of spleen and kidney qi. Unusually, this occurs against a background of kidney yin deficiency, which is evident from the lack of coating on the tongue. Usually, sinking of kidney qi is associated with kidney yang deficiency. In addition, the yin deficiency has given rise to empty heat, as evidenced by the redness of the tongue. The empty heat causes the blood urinary syndrome. Thank you for your attention.